All right, so in this lecture, we're going to discuss the axial skeleton. More specifically, we're going to go over some of the bony anatomy for the skull, as well as some of the vertebrae and some of the other features on the skeleton model. Okay, so the first thing we're going to start off with is the skull. And so the first thing that we do with the skull is we want to identify all of the particular bones that are found in the skull. And so the one here that's in the front, so you have the frontal bone, and then this is what's known as the parietal. And then if you look on the posterior side in blue, this is the occipital bone. So then now we'll turn it laterally. So this is the temporal bone. And then if you look at it from an anterior point of view, this part is what's known as the maxilla. So you have the maxilla, this is the zygomatic bone or the cheekbone. This is the nasal bone. And then this part here in orange, if you kind of look at it to the side, that's the lacrimal bone. Okay, and then this part here, if I'll bring this a little bit closer towards the camera, this part here in yellow, this is what's known as the ethmoid bone. So ethmoid is Latin for wedge. So then if you look at an inferior view of the skull, this part that's kind of shaped like a bat, that's what's known as the sphenoid. Okay, so those are all the general bones that are found in the skull. And so now what we're going to do is go over some of the specific bony landmarks. And so as far as the landmarks are concerned, it's not that complicated if you understand the fundamentals and the basics. So for instance, you have to understand what a condyle is, right? A condyle is a articular surface where we can form a joint. And so a condyle will typically articulate with what we know as a faucet or a facet. And so by knowing the fundamentals, it's easier to identify the bony anatomy because we just add certain words to describe that particular bony landmark. So for instance, we can say like whatever particular region that it is. So an example of what I'm discussing is, so this is the occipital bone, and then these little articular surfaces that are found here, both of these are known as condyles. So to get specific, you just say that it's the occipital condyles. And these occipital condyles, as far as like in articulation, when I say articulation, what I mean is that we're forming a joint. And so, for instance, what I have here, so this is what's known as the C1 vertebrae. It's the atlas. It's what holds the head. And so whenever so this would be the superior aspect. It sits like this, and so you can see it from from a lateral point of view that it's articulating with the faucet here of C1. And so to get more specific, what these faucets are known as, it's the superior articular faucet of the C1 vertebrae. And then the part that's on the bottom, that's what's known as the inferior articular faucet of the C1 vertebrae. Okay, so that's an example. So now let's go and start to identify some of the bony anatomy. And so this model that I have, what I've taken off is the frontal bone, and then also the occipital bone. Okay, so let's start at let's see if I can, it's falling apart. We'll start here kind of like at the base. So I've already mentioned that these are the condyles, the occipital condyles, and then both of these are known as the styloid process. And so when we talk about like processes, so for instance, this is also a process. It's known as the mastoid process. So mastoid is Latin for breast-like or breast-shaped. And so what they serve as is point of attachments for muscles. So muscles will attach here, and then they travel to another particular bony landmark on a bone. Okay, so let's continue. So I said this was the styloid process, this is the mastoid process, these are the occipital condyles, And then if you look at the posterior side of the occipital bone, so this part is known as the external, so it's on the outside, so external occipital protuberance. If we look at a lateral view of the skull, so this part is a meatus. A meatus is a canal-like opening. So this is the external, so it's on the outside, acoustic because we're hearing things, so it's the external acoustic meatus. And then you also have on the inside, so this part right here, this is the internal acoustic meatus. So I can point it from that view. So that's the internal acoustic meatus because it's on the inside. So then if I also continue, I'll see that this part here, so this is the zygomatic arch forming here on the temporal bone. And then if we look at it from an inferior point of view, right, because I've taken the top off, like I mentioned earlier, this bone is what's known as the ethmoid bone. And so if I take this ethmoid bone out, so if I take the ethmoid bone out, this part that's here at the top, it sits in there like this. And so that's what's known as the crista galli. So the crista galli is a part where the dura mater will attach to. And then if you look at it from this side, so where number 16 is, this is what's known as the cribriform plate or the cribriform foramina. And so you have a cranial nerve that sits on top of here, which is known as the olfactory, so it helps with smelling. And then if you look at number 18, this is in the front, this is what's known as the perpendicular plate. So the perpendicular plate, so once we set this here on the inside, let me see if I can get it. So once we set it here on the inside, it articulates with this part. So this part is known as the vomer. So you have the vomer, which becomes the, merges with the perpendicular plate. So then if I take this back out, we also have what's known as concha. So concha is Latin for snail, and so if you look at it from a lateral point of view, it kind of looks like a snail. So the one that's here, that's on the top, so number 19, that's what's known as the superior concha. And then the one that's below it, number 20, that's what's known as the middle concha. And then the one that's inferior, so can you see this through the, can you see 21? Yeah? Yeah, so 21 is, let me see about. Okay, so yeah, I'll just take it off right here. So if you see it from a lateral, from this point of view, you bring it up. Yeah, so that's the inferior concha. Okay, so I'm going to put this back together. So now I want to show you why this is important. So if you look at the half head model, so all three of these are all concha. So you have the superior, middle, and then the inferior concha that's found on the ethmoid bone. Okay, so I'm going to leave the ethmoid out for right now and then go to the sphenoid bone. So this part is smaller, so this is the lesser wing. So you have the lesser wing and then the greater wing, which is here on the bottom. And then number 14, that's here, this is where the pituitary gland sits. And so the pituitary gland is the master regulator for the endocrine system. But it's also so we call it a fossa. So they call it the sella turcica, so it's like the Turkish saddle. And so that's what houses it, the pituitary gland. So it's the sella turcica and then the hypophyseal fossa. So hypophyseal is what they use for pituitary gland. Okay, so we've identified the lesser or the greater wing, which is also found here on the bottom. And then if you look here, this is the maxilla, and then this is in red, that's the palatine bone. So this is the hard palate that forms the mouth. Okay, so I think that's most of the structures here. So then now we've already identified most of that bony anatomy. So now we're going to go through and identify some of the different foramen. And so foramen are holes or canals. And so why this is important is because once we get to the cranial nerves and the nervous system, we'll learn what cranial nerves pass through each of these foramen. But we need to have an understanding of the basic foramen. Okay, so the first thing we have to do for every bony anatomy station is we have to orient ourselves. We need to know what it is that we're actually looking at. Okay, so some of the easy ones, so this one here, this is a fissure. So a fissure is a slit-like opening. So you can see it from this point of view, and then also if I turn it from here, you can also see, so this is the superior orbital fissure, and then this is the inferior orbital fissure. Okay, so then if I also put the probe through here, this is what's known as the optic canal. So you have the optic canal, so coming through here. Okay, the easiest way to remember the next foramen that I'm going to go over, all you have to remember is Rolls, R-O-L-S, like a Rolls Royce. So the first one is what's known as the foramen rotundum. So you have the rotundum and then the foramen ovale. So if you see the ovale, it's shaped like an oval. So that's why they name it about it. And then, this way? Yeah, so it's R-O, and then the foramen lacerum is the one that's most medial here. So that's what's here. So that's L, and then S is the foramen spinosum, which is the real small one that's lateral to the foramen ovale. And so whenever you're identifying these, you always want to have like a point of reference, like a place to start at. So for instance, I always look at the foramen ovale because it's so obvious. And then from there, I can just back up, and then I see, okay, that's the lacerum. And then I'll see that that's the spinosum, and then I know that this one is R, starts for the Rolls, it's the rotundum. And then, so the one that's lateral to the foramen lacerum, so if I stick so let me backtrack a little bit here. So this one that's a little bit larger, this is what's known as the jugular foramen. So you have the jugular foramen, so jugular is referring to, it's referring to the neck area. So then you can also see it here from this point of view. So you have the jugular foramen, and then this is what's known as the jugular fossa, right? Because fossa is a depression. And then we can also see those are the condyles, and then what's coming out through here, that's what's known as the hypoglossal canal. The hypoglossal cranial nerve is what passes through there. Okay, so I said that this was the styloid process, so then this is the styloid foramen. And then now if we kind of go back up, so if this is the jugular foramen, then this one that's coming out over this way, this is what's known as the carotid canal. So the carotid canal is there, and then you can also see it, I'll put the probe through it from the bottom. So this is what it looks like coming through that way. Okay. And then also the large one here, that's at the very bottom. This is what's known as the foramen magnum, right? Magnum is large. Okay, so that's all the bony anatomy for the skull. The next thing to go over is this. So this is the mandible. Okay, so mandible is referring to the mouth, and so it sits like this. So it sits like this within the skull. Okay, so the one that's here at the top, that's what's known as the condylar process. And so that's what's articulating with the mandibular fossa, which is right there. Okay, so now let's look at some of the other parts. So this is a notch. So this is the mandibular notch, and then you have the coronoid fossa. So you have the coronoid fossa. This part is the ramus, or the ramus of the mandible. This is the angle of the mandible, and then this is the body of the mandible. Okay, so the next thing that we need to go over are the different types of vertebrae, because you have different, so vertebra refers to an individual one, vertebrae is a specific segment. And so you have seven cervical vertebrae, and then you also have 12 thoracic, 5 lumbar, and then 5 that are fused with the sacrum, including the 4 that are fused for the coccyx. And so what I have here, both of these, I mentioned earlier that this was C1. So this is C1 and this is C2. So you have the atlas as well as the axis. And so let's go over some of the particulars of this. So one of the distinct features of the cervical vertebrae is it has what's known as the transverse foramen. So transverse, and then the foramen is the whole. And so what passes through the transverse foramen, if you look at, so this in the camera, the vertebrae? Yeah? Okay, so if you look at it from here, you can see the vertebral artery that's passing through the transverse foramen of it, coming through our vertebral column. Okay, so let's go over the parts. So for C1, both of these are faucets. These are the superior ones. And then the ones on the bottom, these are inferior. So then you also have these tubercles. So this is an anterior one. This is a posterior tubercle. And then this is the notch here. So if you can see it, that's number 46. So 46 is the notch. And so it's a notch for C2 because C2, this part is what's known as the dens. And so whenever you shake your head no, right, this is what's happening right here. It's moving in this direction. Okay? So the dens is what's articulating with this faucet here. And then another distinct feature of the cervical vertebrae is the spinous process. So it's bifurcated here on the spinous process. All right, so we have C1, C2, and let's see, what else? Yeah, so that should do it for here. And then 49, this is the body of C2. Okay. So now let's identify some of the other vertebrae. So this one here, I know that this is a cervical vertebrae. It could be C3 through C7 because you can see the bifurcating spinous process as well as the transverse foramen. And then I know that this one is a thoracic vertebra because first off, you look at the kind of the shape of the body. And so this one is like heart-shaped. And then another distinct feature of it is that within these transverse processes, you have the transverse fossa or facet, which is what articulates, or I'm sorry, this is thoracic, yeah. So that's where it articulates with the rib. So this articulates with the rib as well as these portions right here will articulate with the rib. Okay, so that's thoracic. And then the last one here that I have is the lumbar. And so I can tell it's lumbar based off the kidney-shaped or the large body that's here on the bottom, as well as the flat spinous process. So let's go and identify some of the parts of the vertebra. So you have the body, which is here, and then you have the pedicle. So pedicle is foot. So you have P, so I just remember PLS. So you have the pedicle, this part is what's known as the lamina, and then this is the spinous process. You also have the transverse process, which is here, that's lateral, and then both of these are faucets, so the superior and then also the inferior articular faucets. Okay, and then this is the opening for where the spinal cord travels through. Okay, so these are all the different types of vertebra. And so now what we can do is we can see, let me move this over a little bit. So if we look at it overall, we can see how they kind of like stack on top of each other. And so what's in between each of these vertebra is what's known as the intervertebral disc. And so the intervertebral disc, in order to keep the contents that are on the inside, we have what's known as the annulus fibrosus, which is on the outside. It's this collagen that kind of like wraps around it, and then on the inside is the nucleus pulpus. And so that's like the gelatinous part that's in the middle. And so what can happen is what's known as a herniated disc. So if you look at this model here, it shows that the herniated disc is this part. And so what happens is that nucleus pulpus will penetrate through the annulus fibrosus, the ring on the outside, and then what can happen is it can pinch on that nerve. And so when it pinches on that nerve, it can alter some of the sensation that you feel depending on whatever the part of the leg that it innervates, that it gives nerve supply to. Okay, so I think that's a good point for this. The last thing that I kind of wanted to show you, I'm going to bring this skeleton here, and we're going to look at some of the parts of the rib. And so the first thing we kind of want to look at is like how this whole thing is set up. So the first thing is that you have the sternum, and then what articulates with the sternum is this is the clavicle. So you have the sternal head of the clavicle and then the acromial end of the clavicle. And then this here, this is the first rib. So the first rib is forming here, which is known as the so you have the sternoclavicular joint, which is here, and then the sternocostal joint, which is forming right here. Okay, so the next thing is like how many ribs you have. So like the first, so 1, 2, 3, 4, 5, 6, and 7, all of these are articulating right here with the sternum. So these are known as true ribs. You also have false ribs, and then the last two are the floating ribs, which are here at the bottom. Okay. So what we want to identify is some of the parts that make up the rib. So number 54, this is what's known as the head of the rib. So the head of the rib will articulate with the thoracic vertebra, and then this is what's known as number, let's see, what is that? 55, that's what's known as the neck. And then on the back side, so if I turn him around, so this is the process. So this is the process that's going to articulate here with the transverse facet of the thoracic vertebrae. And then this is just the angle of the rib. Okay. All right, so that's going to do it for this lecture. Are there any questions?